The broadcast is now starting. All attendees are in listen-only mode.
Hi, everyone, and welcome to the Reality of Fake Clinics and Abortion Pill Reversal. This is a teach-in hosted by Reproaction. We are so excited that you're joining us on this Thursday afternoon, wherever you're coming in from. We are going to start our training at 6:05, so now is a great time to grab something to drink or eat and just get yourself comfortable. We do not have video functionality, so don't worry about how you're looking. Feel free to get comfortable and we'll reconvene at 6:05. Awesome. It is now 6:05. We're going to get started with our training tonight. So to kick things off, we're going to introduce our presenters. This voice that you're hearing right now is Caitlin Blunny. I use she, her pronouns, and I'm the Outreach and Culture Manager over at Reproaction. You can find me on Twitter or tweet at me or tweet along to this at Liberal Jane with 2 E's.
And the voice you are hearing now is me, Ten Henson. I use they, them, and she, her pronouns. I am the North Carolina campaign coordinator with Reproaction, and you can find me on Twitter at DJ Dump Them.
So, for folks who may be new to Reproaction or not quite know what we're all about, we lead direct action to increase access to abortion and advance reproductive justice. We are very proud of our left flank analysis, and we're not in this fight to protect the past or maintain the status quo. We, of course, celebrate legal, accessible, and funded abortion as a great thing. And we also embrace sex and sexuality, as well as hold the right to parent and the right to raise children in safe and healthy communities as equally sacred in our struggle for dignity. So a little bit about how this night's going to go. So we're going to get started with introductions. We've already done this part, so you're already well underway in getting this training. We're next going to talk a little bit about what is happening with abortion access in this country right now, ground us in this moment. We're then going to shift into a little bit of a one-on-one on fake clinics, tell you everything you need to know about crisis pregnancy centers, as well as abortion pill reversal. We're going to look at a case study. We're also going to address some misconceptions that exist, things that perhaps make it difficult to talk about this issue, or common arguments that we hear about fake clinics. We're then going to talk about how you can take action locally, share resources, and then at the end, we're going to do Q&A. If at any point during the presentation you have a question, you are more than welcome to put it in the chat box. We will likely wait until the end of the presentation, but you are welcome to do that throughout the session. In addition, we will be recording this and sending it out to participants after. So if you're somebody that wants to take notes or something, that will be available to you after this training. So just to kick us off, I want to ground us a little bit in this moment. So first, we are a couple months into Joe Biden's administration, and we've seen some good changes over these last few months, including the rollback of the global gag rule, as well as a reversal of the Trump rule that blocked abortion providers from participating in Title X and receiving family planning dollars. We hope to see the administration do more over these next few months and, of course, several years. But there are also some not so great things happening with abortion access right now. Last week, the Supreme Court announced it would be taking up its first abortion-related case since Amy Coney Barrett was confirmed to the court last October. And this case comes from Mississippi and would ban abortion after 15 weeks. 15 weeks is well before viability, and so this case is extremely concerning because it has the ability to undo the legal precedent of Roe v. Wade and open the door to make abortion illegal in this country, which is very concerning. The Supreme Court just announced it would be taking that up last week, as we mentioned. And so we expect to hear oral arguments in that this fall and then expect to have a decision in 2022. We are also in the middle of a pandemic still, or nearing towards the end, hopefully. And COVID-19 has increased the need for abortion care, and in particularly abortion funding. I want to uplift that a lot of abortion funds right now are seeing an increase in demand. And many are running out of funding or having to increase funding to meet the growing need. In addition, many independent clinics are struggling to stay afloat right now. I know typically when we think of abortion access in the US, many of us might think of Planned Parenthood right away. But in actuality, 2 out of 3 people who receive abortion care in the US do so at an independent clinic. So these are clinics that typically don't have the money or the resources or the support they need to deal with state restrictions or other attacks that they may be facing. And that leads us right to state legislatures, and it's, of course, abortion restriction season. So we've been seeing a lot of terrible legislation from a number of places. I think most notably, Texas last week passed and signed an extreme abortion ban which was a 6-week ban, which is just so extreme. It's way before most of us know that we're even pregnant, and would allow strangers to sue Texans for helping someone access abortion care. So this is a pretty concerning law because it's going after those who support people seeking abortion access. But it's important to note throughout all of this that abortion is still legal in all 50 states. And the Texas restriction I mentioned earlier will likely be challenged and blocked before it's supposed to take effect on September 1st.
Thank you so much, Caitlin. And with that grounding, we are going to just hop right into fake clinics. So you may have seen signs or billboards in your community advertising free pregnancy tests or ultrasounds, or you could even see things like this on the internet, ads and things like that. And there is lots of different advertising and things that they do, and we're gonna hop into it. So if you could click the next slide, Caitlin. So what are fake clinics? Fake clinics are known as crisis pregnancy centers or pregnancy resource centers. They often appear as a clinic with a neutral sounding name, and they try to lure people in with that. And their goal is to mislead and shame people from seeking abortion care. There are over 2,700 fake clinics in the United States. Nationally outnumbered real clinics 4-1, and it can be higher in certain regions. And clinics have some kind of medical licenses, but the vast majority don't, even if it might appear that they do from the outside. So some of the tactics that fake clinics use, with location, for a big one is fake clinics will often position themselves close to abortion clinics and colleges and universities. So I see in my community a fake clinic across the street from one of the biggest colleges in my city. And we can see how predatory that is with young folks needing help. They might turn there because it's accessible to them. They will use deceptive names. So fake clinics will use names like A Woman's Choice or Options to make people think that it is a real clinic, when in reality they only see one kind of choice or option there is to make. They will do geolocating and targeted ads. So they conduct online surveillance on people seeking abortion care and try to redirect them to CPC ads instead. One marketing company was actually blocked in court from using geofencing technology that sent anti-abortion ads to people using their phones inside abortion clinics after having sold their services to 2 CPC networks years before. Another group uses internet marketing and search optimization to reach people searching for local abortion providers online. And often when somebody searches abortion with their city or zip code, fake clinics will appear at the top of the ads. Another tactic is shame. Clinics may bring someone's faith or family or junk science into the conversation to try to get them to change their mind about having an abortion. One clinic even went as far as forcing people to sign a contract saying they would carry to term and threaten legal action against the nearby abortion clinic if the person chose to seek services there. The misinformation they share is lying about gestational age, telling someone they have more time to decide, or that they are past the legal limit within their state. They inflate the miscarriage rate, which may influence someone who is concerned about paying for their abortion to wait it out. An important note there is the miscarriage rate is about 10 to 15%, so it is low and does not need to be used in a sort of agitating way. They lie about what abortion procedures actually are and what happens during them, and the lies about the impact of abortion, including false ideas of that abortion increases your chance of breast cancer, infertility, or substance abuse. And one more tactic that fake clinics use is the promise of support or resources. So there are plenty of stories of people going to a CPC and being lied to and harassed. There are even stories of people who carry pregnancies to term because they were manipulated by fake clinic staff who promised to help them and then are ignored after birth. So fake clinics often don't just give items donated to them. In many cases, fake clinics offer what they call mommy bucks as a part of their earn while you learn programs, where people seeking pregnancy or parenting items have to listen to brainwashing anti-abortion, anti-sex lessons, or receive Christian ministry education to earn certificates they can use in exchange for a few packs of diapers. And as vile, racist anti-abortion fake clinic operator Abby Johnson revealed, these services have an expiration date. She said herself, quote, "If I were to open a pregnancy center, I would not have pregnancy items past 6 months. Are we running a charity? Are we running a place where we want women to become self-sufficient? Cut them off." The bottom line is that you shouldn't have to sit through the accusations and guilt trips and lies peddled by fake clinics just to get the help that you need. And then there is the public funding of fake clinics. So while many clinics do receive many private donations, a shocking amount is subsidized by taxpayers. So direct funding includes an example of Pennsylvania's Real Alternative programs and Texas's Real Alternative programs, where the state rewards grants directly to fake clinics. Fake clinics offer classes and instruction manuals to their center operations to apply for government funding for various issues such as sexual violence prevention, sex education, and domestic violence prevention and counseling, which mean actual professional services in those fields go unfunded as fake clinics suck up all that money. TANF dollars is another way fake clinics will receive funding. So in at least 7 states, including Indiana, Michigan, Missouri, North Dakota, Ohio, Pennsylvania, and Texas, they have all allotted tens of millions in federal TANF dollars, which is temporary assistance for needy families. That is what TANF stands for. And that money is going to fake clinics. So that means money intended to go to hungry children and their families is being funneled into these fake clinics. And another point of funding for fake clinics is the life license plate programs. So license plates in 32 states use life license plates, another area where taxpayer money goes towards fake clinics. So a case study, Real Alternatives. So Real Alternatives is a Pennsylvania-based group that claims to provide crisis pregnancy center counseling and education and subcontracts with fake clinics in multiple states. In Indiana, while Governor Mike Pence diverted $3.5 million in TANF dollars to Real Alternatives in 2015, plus $1 million in estate funds the year before. As of mid-2016, Real Alternatives oversaw 93 sites and partnered with 29 organizations. According to Cosmopolitan, they allot a maximum of just $24 worth of material assistance per pregnant person who visits. So the impact on our communities. Fake clinics cause real harm within our communities, especially for women of color, people experiencing poverty, and folks living in rural areas who often have less access and fewer options for healthcare generally. One fake clinic chain in particular called their outreach effort to women of color their, quote, urban initiative. They also cause harm, especially for people facing intimate partner abuse and sexual violence. Survivors need access to unbiased help and resources, not shame and devaluation from incompetent staff who may not even be licensed medical providers. It's important to note that fake clinics are not bound to HIPAA regulations, which helps ensure privacy over medical information. So fake clinics aren't necessarily always required to be protecting the people who they see in their fake clinics. These fake clinics affect young people because young people may go to a fake clinic not realizing it's a fake clinic, or a fake clinic might come to their school advertising their services. And it's important to note that many fake clinics offer abstinence-only programs, as if abstinence only can really exist, an approach to sex ed that has proven to be ineffective time and time again. And like I stated before about funding, it is really affecting TANF dollar recipients. People who have been, this funding for these programs has been taken and whittled down by fake clinics who are misusing funding that should be helping to feed families. And it's simply not fair.
Thank you so much for that overview, Ken. That was awesome. We're going to shift into talking about abortion pill reversal, which may be a new concept for some folks. And a good place to start with this is just talking about what an abortion with pills is. So if we back up for a second, typically when someone has an abortion at a clinic, there's two types of procedures. So there's medication abortions, and then there are the in-clinic procedures, which many of us may associate with things like D&Cs and other forms of abortion care. So a medication abortion in particular is a combination of two pills, two types of pills. The first is mifepristone, which is typically given at an appointment. It's important to note that in particular with mifepristone, it's typically required, depending on your state's laws, it's required that a certain type of medical provider administer that pill. So in some states, it has to be a licensed OBGYN. Other states, it might be a nurse or midwife. But typically, it's some type of medical personnel that gives you that pill that you take at the clinic. And then the patient is typically sent home with misoprostol, which is taken later, either orally or inserted vaginally. These types of abortions typically go up to 10 to 12 weeks, depending on local state laws or clinic preferences and regulations. So how does a medication abortion work? So a medication abortion works with first mifepristone initiates the abortion, and misoprostol causes the uterus to cramp and expel the contents of the uterus, thus ending the pregnancy. So this is where abortion pill reversal comes in. So if we think about the process of somebody having a medication abortion, as we mentioned, there's the two types of pills. Somebody goes to a clinic, they have mifepristone, and then they go home and finish the process. What the opposition is claiming is that after someone takes mifepristone, before they take misoprostol, they can flood the body with progesterone, which is pregnancy hormones, to continue the pregnancy. It is an absolutely false claim, and there's no proof patients receive accurate, clear, and ethically provided information or give consent before treatment is given through these fake clinics or elsewhere in the abortion pill reversal network. It's important to note the American Medical Association and the American College for OBGYNs has criticized abortion pill reversal and laws that force doctors to counsel patients about it. Abortion pill reversal has become real popular in the last several years. Since 2015, several states have introduced, passed, and enacted dangerous legislation that forces doctors to tell patients about abortion pill reversal, despite the fact that there is no proof or evidence or really ethics about this assertion. And after the governor of North Dakota signed a reversal bill in 2019, the American Medical Association actually initiated a lawsuit to block block that bill from taking effect. And I lift that up because, in particular, the American Medical Association doesn't typically speak up when it comes to things related to abortion. It can seem political, and typically they don't get involved. For them to get involved in this way and come out so strongly against abortion pill reversal is a big deal. The idea of so-called abortion pill reversal is an attack on abortion rights, free speech for doctors who actually practice medicine, and the dignity of all people who've decided to have an abortion. There is no proof that this speculative treatment proposed by anti-abortion activists works. And the anti-abortion physician, Dr. George Delgado, is credited with developing the unproven theory of abortion pill reversal. His development of this regimen amounted to a series of poorly designed, unethical experiments. In particular, his second study on this method had no ethical oversight board approval, which is a requirement for medical research on humans. And he's also tried to run multiple studies, but all of the studies he's run were flawed because they did not include a control group. And it's highly possible that some of the patients weren't fully aware that they were being experimented on. Most recently, researchers at the University of California at Davis conducted a study to test Delgado's claims, but unfortunately that study had to be stopped after 12 women enrolled because 3 of the women had to be transported to a hospital for treatment for severe vaginal bleeding. At that point, the researchers decided that the risk to participate in this study was too great to continue, though it met other requirements for safety and ethical oversight. Furthermore, doctors are supposed to do no harm and inform patients about all of their options, not give them coercive, false information. When we think about going to the doctor, when you think about going to your primary care doctor or specialist, you want to trust. You shouldn't have to second guess what your doctor is telling you. Without regard for safety, abortion opponents have not bothered to put their theory of abortion pill reversal to accepted methods of scientific testing and review. Instead, they've experimented on people without fully informing them that they're subjects in an experiment, which joins a very troubling history in the United States of non-consensual medical experimentation, especially targeting people of color. This also all reinforces the sexist idea that women and people with capacity for pregnancy are indecisive and incapable of making decisions. This is something that gets wrapped up in this idea of abortion regret, which is something that we see the opposition say a lot. We know from the Turnaway study that 95% of people who have abortions do not regret their decision. The overwhelming majority of people say that they feel relief. So with that, we're going to shift into addressing some common misconceptions. And I want to thank some of our audience members. Some of y'all left some really awesome questions when signing up for this event, and we definitely drew on them for this section of the presentation. So we're going to jump into some common arguments that we hear about fake anti-abortion clinics and abortion pill reversal.
So the first misconception is that fake clinics help new parents. While fake clinics offer free pregnancy testing, options counseling, and other services, it's not quite free when it comes from shame. When it comes with shame, excuse me, misinformation, and religious ideologies. I mentioned earlier that many products aren't free and often must go to earn while you learn programs. The bottom line is fake clinics don't exist to give out free resources and support people with their pregnancies or children. Their primary goal is to prevent people from having abortions.
Another big one we hear pretty often is that how can fake clinics be legal? Unfortunately, fake clinics are considered religious outreach and are protected under the First Amendment. And this is something that the Supreme Court actually took a look at back in 2018 with the case NIFLA v. Becerra. That case had to do with a 2015 California law called the Reproductive Fact Act, and it would require licensed clinics that provide certain services such as ultrasounds, pregnancy tests, and advice on birth control to also post information about affordable abortion and contraception services offered by the state. Unlicensed facilities that would provide these services would have to disclose their lack of medical certification. That sounds like a pretty good law, that it shouldn't be anything that's objectable. But unfortunately, a network of crisis pregnancy centers, including the National Institute of Family and Life Advocates, which is NIFLA, sued in response, arguing that the government violated their right to free speech by forcing them to promote abortion. Unfortunately, in that case, the court ruled in a narrow 5-4 decision and ruled in favor of fake clinics, which was a huge setback.
Another big myth that we hear is fake clinics are small mom and pop operations. Based on Reproaction's research, over 75% of fake clinics are affiliated with larger fake clinic networks. Fake clinics are highly litigious and well-funded. And affiliate networks not only provide resources and support, but also help with branding and marketing. They might also help with lobbying at a local, state, and federal level.
You may be thinking to yourself, isn't it medical malpractice to lie to patients? We know we mentioned that fake clinics that are unlicensed and are not medical facilities are not subject to HIPAA regulations. But because they're unlicensed, they don't fall under medical board requirements. Licensed clinics still lie to patients, and patients have a right to file a complaint with their state medical board. And, if somebody in your life or you yourself has that experience, I encourage you to do it. But if somebody goes to an unlicensed clinic, that option and that accountability, unfortunately, does not exist.
Another troubling misconception is if you're against fake clinics, you're anti-religious or anti-Christian. This is not necessarily true at all. Many religious and spiritual organizations respect the right to choose and are pro-choice because of their religious beliefs, not in spite of them. And furthermore, our country was founded on the idea that no individual will be persecuted for practicing their own religion, and no individual should be allowed to impose their religion on others. We shouldn't be legislating personal beliefs onto other people. This balance is critical to affording religious freedom to every American. The idea that someone can refuse services, lie, or mislead others through their beliefs is contrary to American values.
Our next question, which we get a lot, is how can you tell if a clinic is real or if it's fake? Some good tip-offs could be if ads or flyers for the fake clinic emphasize how dangerous an abortion procedure is. That probably is a good sign it's a fake clinic. If a website has abortion information but nothing about the actual abortion services they provide, so we mentioned some of the common abortion types of abortion care earlier, so medication abortions, DNCs. If you're not seeing any of that language on their website, they're probably not offering it. In addition, you might call and ask to have an abortion, and they might tell you just come in, or they might not give you information over the phone. All of those things are good tip offs.
So some tips for identifying real abortion clinics is to check Google and Yelp reviews, and look for people talking about their experiences at clinics. Often fake clinics have volunteers and others review their praising their services, so be careful when you're looking. They also might advertise abortion counseling without mentioning services they provide. And if you see, that was a point about fake clinics. We're talking about identifying real clinics. I am sorry. Fake clinic websites likely have like abortion information, but like not really real information. So make sure that there's clear listed information about what you're going to be experiencing. And if you see words like limited ultrasound, that likely means that it may be an unlicensed technician. And that's not necessarily what is going to, that's not what's going to be in a real abortion clinic. Another tool you can use is Reproaction's fake clinic database. So this is a free open source resource for anybody who wants to use it. I think it is, I'm pretty sure it is downloadable as a PDF. So this knowledge can be accessible when the internet is not. And you can check your city or zip code to see if there are any fake clinics in your community. And we have a feature on there if a fake clinic is advertising abortion pill reversal. So in taking action on fake clinics, the first thing you can do is direct action. Get in the streets safely, of course. Make sure you're following any state or city ordinances to protect you and the folks that you're with. Have supplies, lots of different people with different skills to make sure that your direct action is fulfilling and not stressful. Doing a direct action to expose a fake clinic, it raises the visibility and the awareness of fake clinics. So people could just be driving by and they're going to be educated and know that that's not a place that they can find real abortion services from. And it's a really powerful tool and can be cathartic and a great way to build community with people in your community who are like-minded about the need for abortion access. Another way you can expose fake clinics is flyering. So you can flyer outside of fake clinics or hang flyers on community bulletin boards in your local coffee shop, college campuses, and more places. This can be a flyer with information about what fake clinics are, and they're super easy to distribute around your community. Another way to expose fake clinics is creating resources. So compile the resources available in your community to distribute online or through flyering. We want to make sure we can think about the resources pregnant people might need, including diapers, doula services, health insurance, and other really crucial resources when a person is pregnant and figuring out what they would like to do. And this can be shared online through Google Docs or on social media. And the last thing is to have transformative conversations. Having one-on-one conversations with your loved ones can help raise awareness and educate folks in your communities. When I started working at Reproaction, I made sure I was sharing information and resources with my loved ones so they could understand more of the work I do and become educated in understanding what is going on in this field. And now my family and friends send me messages when they see a fake clinic or find an article that relates to exposing fake clinics, and it's deeply validating and exciting to see the effort of me communicating with my community come full circle.
I love that. That is such a good mobilizing thing everyone can do from home right now. So we are nearing the end of the presentation, so feel free to crack your fingers, start typing up your questions in the question box. I will say this is our first time doing this presentation, so I think we overestimated how much time we would need. But we are going to stay tuned and answer your questions, and then hopefully give you back some of the time that you dedicated to us this evening. So some resources to learn more if you want to get more engaged in this. Reproaction's Bad Faith Medicine campaign is an awesome place to start. We have so many resources, fact sheets, past webinars, and more. You can also follow Reproaction on Facebook, Instagram, Twitter. I think we also have a LinkedIn if that's up your alley. And you can connect with us to be in the loop about additional trainings, direct actions. We're really hopeful that in the next year or so, or perhaps even in the next 6 months, that we'll be back on the ground doing direct action. So if that's something you're interested in, highly encourage you get plugged in with us. And then if you're somebody that is interested in learning more about where people can access abortion care in your community or your state, the website ineedanA.com is an awesome place to start and also a great place to direct people who are needing abortion care to go. So with that, we are going to open it up for questions. It may take me a second to open up the chat log, so I appreciate your patience. Okay, so here's a question from Emily. She says, or they say, I have seen some campaigns that ask advocates to leave Google reviews on real abortion clinics to try to offset the massive advantage fake clinics have when bringing them up first in Google searches. I volunteered and left a couple, just curious as your thoughts to the strategy. If you've done something similar or have other suggestions on how to push back against their monopoly on the first Google page of results when poor unsuspecting folks in search of care type abortion into Google. That is a great question. Ten, do you want to take a first pick at that?
Sure. I have also seen of organizations and people doing this, and I think as many actions do, it is great. It is getting people together and making sure that information is shared and it is truthful information. Yeah, I think it's generally something that can be helpful. I would personally maybe like wonder if that's something clinics want for them to have their Google search and comments to be coming up with more information, if that makes sense.
That's a great point. Yeah, I think something that we often don't think to do is to reach out to our local abortion clinics to see what type of support they need. So just speaking from my own experience, I live in an area where we have about 3 abortion clinics within the region I live in, and many of those abortion clinics don't want support. They don't want people there holding positive signs. They don't want to engage with folks. They're doctors who want to do their jobs, and that's fair. It's hard to know who you can trust especially in this landscape. But we did have a relationship with a clinic in Northern Virginia, and I won't say the name of the clinic, um, but it ended up the type of support that that clinic wanted was not just what they were receiving online. It was, they wanted people out there holding positive signs. They wanted to make their waiting room like a community space. And we, before the pandemic, of course, were hosting like storytelling events where people could come to their abortion clinic or just the abortion clinic in their community and come and speak about their reproductive experiences, not just abortion, but the full spectrum. And I think we can be really creative and think about how we can build those relationships. I do think Google reviews, especially if you have experience at a clinic, if you've had any interactions, doesn't have to necessarily mean getting care there, can definitely boost it. Because if you look at the fake clinic reviews, there are a ton that are like, I love this crisis pregnancy center. And that might look like it's better or more than an abortion clinic that might only have a couple reviews because, again, patients might not want to ID themselves. Awesome. We have another question here from Reagan who asks, will you guys send the link to the resources in a follow-up email? Yes, I can make sure that we do that. And then we have a question here from Ariana. They say, I work for an organization in Colorado, and recently we organized on 3 college campuses in Colorado to pass resolutions with student governments condemning the actions of fake clinics near campuses. That's exciting. Something I've struggled with in organizing against fake clinics is finding real stories from people who've been to them. Any tips on how to develop those relationships to find storytellers? I'm happy to take a first stab at that. I think, as somebody who volunteers with my local abortion fund doing intake, I think a lot of people don't necessarily realize that they have been to a fake clinic. I've had many conversations with people being like, I went to the clinic this day, but they wouldn't give me an abortion that day. They said they gave me this excuse or this thing happened. And then when you start talking to the person and you start to figure out where they actually went, what the address was, often the person is just so upset that they've wasted so much time and that they were deceived, that can be, it's not only stigmatizing to have to put yourself out there and then to be treated like that, but also just like the anger of like the wasted time and like, when you want to have an abortion procedure, to have to run through a fake clinic to try to get the care you need and then be rejected ultimately is very hard. So I think, the more we talk about what fake clinics actually are, when we say that place on the corner is a fake clinic, I think that's when the stories start to come out. And I've noticed doing campus organizing, I did some work with William and Mary University here in Fredericksburg, Virginia. And students were passing by the local crisis pregnancy center being like, oh yeah, I've been asked to come in there before, or I've been handed a flyer like that from there before, but they weren't able to connect that to the idea that this is a crisis pregnancy center or a fake anti-abortion clinic. Anything you want to add to that, Ten?
You covered most of what I was thinking. I would like to highlight the point of like when we talk about this is when the stories really like can come out, and I think also some people like might not want to necessarily disclose that they've been to a clinic, or maybe it was a really terrible experience and could be triggering for them. And I would imagine maybe some way of like anonymously identifying or sharing a story and like making that accessible often could be a really helpful way for like folks to know that they can like share their story and not have like the repercussions of sharing a story that is very targeted by anti-abortion people.
Yes, I love that. I think people do feel like if their stories don't fit the perfect narrative of what an abortion story is supposed to be, that can also be very hard to overcome. We have another question here from Alex. They asked, how can fake clinics get away with saying they offer abortion pill reversal or progesterone shots and other medical services when it's bad medicine? 10, I feel like you're perfect to answer this.
Yeah. So the the I mean, I think about this a lot in my work, and I get really tripped up sometimes thinking like how is this happening? And I think a lot of it is through the protection that fake clinics have from large corporate level affiliates, which come with money. And they are preying on vulnerable people who are maybe they're confused about their decision, or they need support through their decision, whatever the case may be. And people sometimes opt in. And there are, I think it is the obstetrician and gynecologists for life. Is that right, Caitlin?
Yes.
Yeah, they also will speak about abortion pill reversal, um, which gives it this kind of like credibility that it doesn't deserve. And those are the kind of like the things in my head right now. I don't know if you have anything you want to add.
Yeah, I think in particular with these laws that are trying to force doctors to give misinformation about abortion pill reversal, to tell patients about this. I think we've seen in the past, and a number of states still have restrictions that require bias counseling where patients are told, having an abortion will increase your rate for breast cancer or cause infertility or make you depressed or abuse substances. Um, and I think they are trying so hard to legislate this into existence to make it a thing. So that way people before they even know an abortion pill reversal, they're at their appointments getting counseling and they're being told about this idea. And so I think that unfortunately legitimizes it. And I think the opposition is doing a very good job trying to, get themselves to seem like they're scientific or seem like they're doing things that are medically correct, but it is just bad faith medicine.
Yes, bad faith medicine indeed.
Reagan added that pro-life and fake clinics market really heavily in the South with billboards and bus bench posters.
Yes, they do. They do. I've been there. There's a new right next to the crisis pregnant, the fake clinic I was talking about earlier, across the street from college campuses. They just got a new billboard put up as well, and I've been seeing them more and more. It's quite alarming.
It's very concerning. I can say I'm from New York, and I was surprised when I moved to Virginia 5, 6 years ago to see so many people with like the Choose Life license plates. And I mean, you see it in New York, but it's a lot easier to ignore than it is down south. Okay, I'm gonna do a last call for questions. You all have done a great job generating them, but want to be mindful of everyone's time. Okay. Well, I want to thank you all for spending the time this evening learning about this issue, engaging with us. If you are interested in getting involved in the campaign or you want support in taking action, maybe you're like, in 2 months, all my friends are going to be vaccinated. We want to do a socially distanced direct action outside a fake clinic. We would be happy to help you figure that out and give you all the tips and tricks you need to know. You are more than welcome to reach out to us over at reproaction@gmail.com, as well as connect with us on social media. And with that, just want to give a very big thank you to you all, and we hope to see you at the next Reproaction webinar.
Yes, agreed. Thank you all so much for being here.